Welcome to another video. With a new video comes a new case, and we're continuing with our theme of running injuries.
This week we had a high school long distance runner come in with shin splints, but with further investigation there was more to this condition. Stick around to hear what happened in this case and learn how to get relief from shin splints.
Hi everyone, my name is Dr. Ryan Evenhouse, and this is Dr. Mick Pinkney. We had a 16-year-old female who was a long-distance runner at her high school. She started developing pain in the front of her shin after her runs from practice and went to seek care from the athletic trainer. The trainer recommended taking some time off and seeing if rest took care of her symptoms. After some time off, she went for a usual distance run and developed severe pain afterwards. This time she noticed the pain felt a little different. At this point, she now presents to our office for an evaluation and for treatment.
After hearing her case, we knew the athletic trainer had assumed she had shin splints because of the pain along the entire shin and described as sharp and stabbing. The trainer did the right thing by having her rest, and once she started running, the pain had changed, and this time it was more focal and more horizontal pain. We were concerned about this change in her symptoms, so we ordered an MRI of the leg to determine if there was something else going on. After the imaging had come back, there was a clear stress fracture along the mid-shaft of the tibia, which is not uncommon in long-distance runners, especially mimicking the symptoms of shin splints. So after this time, we gave her the boot.
And by gave her the boot, Dr. Mick means we booted her leg to limit forces through the tibia, so the stress fracture could heal. After she was booted for about 6 weeks, we were able to take the boot off and start with treatment to return to sport. Unfortunately, even with only 6 weeks off, significant muscle atrophy can occur, so our goals were pretty simple. We needed to strengthen the leg and make sure she had full functional range of motion through the ankle.
So to start, we wanted to address the movement compensations from wearing the boot. Oftentimes, patients will kick their leg out to the side when walking to avoid tripping with that boot. If you've ever worn a boot yourself, you may have noticed you started experiencing knee pain or lower back pain with walking. To address this, we adjusted the sacroiliac and the mid-back to get everything moving. We also decided to use some mobilization of the ankles, but we chose mobilization and not adjusting because it wouldn't be appropriate to put a ballistic force through that ankle after just healing up from a stress fracture. In addition, we used manual treatment, which included an instrument-assisted soft tissue mobilization and pin and stretch techniques.
Along with those modalities, we also started an exercise program to address the muscle atrophy. We started out with balance exercise, including a star balance and frog hop, because they were lower impact and strengthened the smaller stabilizing muscles of the leg. The balance star addresses balance in multiple planes of motion in the hip and knee, which is important for any running athlete. And then the frog jump is a lower impact, more dynamic to work on the glutes and abs to control the landing of their jumps.
Once this patient was able to demonstrate the efficiency without increasing pain of those exercises, it was time to start progressing to more challenging exercises. In this case, we started her with the curtsy lunge and the jump down. During the curtsy lunge, it's a great challenging exercise to help control the single leg balance in a diagonal movement, which allows the glutes to help control. The jump down is a progression from the frog hop, where the benefits are similar but much more challenging. If you are working out with a partner, have that partner observe with that exercise to watch how your knees land. What we don't want is any buckling towards the midline, and that signifies the glute medials are fatiguing. Whenever training, we want to always work within a group where the muscles are not fatigued to help decrease the chance of injury.
So this is not an exhaustive list of all the exercises we performed with this patient, but highlights a few we thought were integral to her recovery. And as she continued to strengthen without showing signs of pain, we had her start running between appointments to observe how the treatment was going and to make sure she was on her way to return to her sport. Overall, we're happy to say she had a full recovery and was able to return to her sport after 6 weeks of treatment after her stress fracture had healed.
Thanks for watching our videos. We hope you've enjoyed this case and learned something of value. If you want to see more content like this, be sure to subscribe and get so you're notified whenever we have new videos come out.
For complete rehabilitation, I'm Dr. Ryan Evenhouse.
And I'm Dr. Mick Pinkney.